Greetings and thank you for tuning into our submission for the geriatric case competition. We are Group 14, led by expert coach Dr. Fun Lee, and this is an interdisciplinary approach to geriatric care for Mrs. Johnson. Here you can see an overview of our team, dedicated professionals who've been going over this case for weeks to bring you the best professional insights to the case. We've got Nathan from physical therapy, Harsheen in healthcare administration, Tara in dietetics, myself as the nurse practitioner, Lindsay, Bradyn from dentistry, and Ariella, our psychology expert. Catherine Johnson presents for her initial telehealth visit with several complex health conditions that are suboptimally managed due to functional limitations, frailty, multimorbidity, and social determinants of health, not limited to financial insecurity and living in a rural setting. This leads to the development of the question, is Catherine safe to stay at home? We aim to empower her and her family with a realistic plan to see if we can achieve this safely. We have utilized the 5 M's of geriatric care to meet Mrs. Johnson where she's at and provide comprehensive and holistic services. You can see some of the ways that her specific considerations fit into this. We recognize and seek out what matters most: home, family, and community. We aim to optimize her mental health and mobility, pay special attention to reducing risks amongst her medication profile, and address multiple complexities and unique circumstances that she presents with. This framework has shown to improve outcomes in older adults and replace low-quality services with cost-effective ones. Our dedicated team of 6 are not the only ones rooting for Catherine's care. You can see a glimpse of her vast healthcare network here, starting with her family as the inner circle, then reaching out to primary care and a wide variety of other disciplines that are uniquely prepared to bring innovative treatments to her care. As the primary care nurse practitioner, I will take on the role of care manager and be the point person for Catherine. In addition to coordinating with other disciplines and providing medical management, I will aim to establish a strong rapport with Catherine through active listening, therapeutic communication, and the use of a family-centered approach that is all-inclusive. Individual goals and learning needs assessments will be completed with each family member to encourage understanding and shared decision-making throughout all aspects of care. Now let's get into analyzing Catherine's chronic disease management through the lens of optimizing health and reducing risks. For her diabetes, her current A1C is acceptable for a frail older adult, though her regimen exposes her to significant risks. In addition to reinforcing diet and glycemic awareness, there are several medication changes that I would recommend. Glipizide should be discontinued. It increases warfarin, increases the risk of cardiovascular events, and it's present on the Beers list and stop criteria as an inappropriate medication for older adults. The dulaglutide was never started by Catherine and shouldn't be. It's complicated, it's an injectable, it's costly, and the weight loss wouldn't be ideal. The empagliflozin can be continued at a low dose, but the effects on her urinary concerns must be highly monitored. There's evidence that the benefits might outweigh the risks because it can prevent heart failure and CKD in people with type 2 diabetes. The Lantus can also be discontinued, but the dose should be reduced to limit hypoglycemia, and a long-term goal of discontinuing it overall should be maintained. Metformin is another medication that we would continue, as it is first line and she has no contraindications listed. Her cholesterol medication, the rosuvastatin, should be replaced with atorvastatin, as it's shown to interact with warfarin and also increases the highest risk of associated GI bleeds. I would recommend getting Catherine set up with a continuous glucose monitor, which is supported by the ADA guidelines, as older adults should have them when they're on insulin. Her hemoglobin A1C should be rechecked every 3 months until long-term control without changes is established. Now, looking at her blood pressure, she had a good reading today, goal of less than 130/80 per AHA standards. I would consider replacing her metoprolol. There's no evidence that a beta blocker is necessary 3 years post-valve replacement, and it's on the stop criteria for masking hypoglycemia. An angiotensin receptor blocker would be a better first-line medication choice and could be combined with a hydrochlorothiazide diuretic if that was necessary. Even though she didn't tolerate a diet a thiazide diuretic in the past due to hypokalemia, combining it with an ARB would make it a safer profile. I would recommend this instead of continuing spironolactone unless further evidence of heart failure is uncovered, as it increases the risk of dehydration and interacts with the empagliflozin. I would want to teach Catherine about monitoring edema and weight, in addition to helping her obtain a home blood pressure cuff for regular readings. Lastly, let's talk about her anticoagulation. Her most recent INR is within range, though she has had large fluctuations overall. The warfarin must be continued. It's the only approved choice after mechanical valve replacement, but it would be appropriate to manage this in primary care without any other red flags. Ideally, we would have assistance from an INR clinic or home health professionals, which in that case, they could actually do the INR readings for her. Education on bleeding, stroke risk, medication interactions, and obtaining a medical alert bracelet would all be important to educate the entire family on. Regarding Catherine's other medications, I would want to consult with a pharmacist to go over these changes, especially knowing we really shouldn't make more than one change every 2 weeks. There's no indication for the iron, and the same is true of the B12, although she could be at a risk of malabsorption due to her PPI use. I also would like to taper or discontinue this, as there's really no indication, depending when her last GI bleed was, to continue this long term, even if on warfarin. I also want to make sure she's taking this correctly because the instructions to take daily before meals seem unclear to me. The other supplements are appropriate with education, and amoxicillin is a good choice for dental procedures as it doesn't typically interfere with warfarin at that dose. I want to make sure to review and reconcile all of these at each visit, particularly with a family member present. Next, we need to address her falls, in which I really recommend a referral to PT to help me reinforce prevention, environmental engineering, and emergency planning while she gets stronger. Her urinary incontinence and the impact it's having on her quality of life are equally important. I would implement further questionnaires to try and distinguish the exact type and educate on incontinence products, irritant avoidance, and appropriate fluid intake. Bladder training would be a great intervention, and topical estrogen could be considered as a pharmacological option if needed. I would also ask Catherine to keep a bladder diary to monitor her progress. A couple of additional items to uncover. I'd want to get a closer look at her stiff neck and rule out injury, look at her thyroid function, assess for heart failure with the BNP, and consider a workup for rheumatoid arthritis. She also has several health maintenance items that need to be recovered or addressed, with high importance placed on getting a mammogram due to her family history and also assessing osteoporosis with her falls. I want to touch again on including the family in all of this and continually assessing the impact of Catherine's care on them as individuals, making sure they have their own resources to meet their needs, and talking with them at each visit. I'd rely on my entire team to help me do this as well. And there's several important referrals I would place. I want to specifically point out social work in addition to the others listed. They can assist with advanced care planning, assess readiness for assisted living as a backup plan, and establish telephone and internet reliability with services like the Lifeline program. They can also help develop deeper family assessments to provide us all with good information and understanding of their relationship. Next, I'll pass it off to one of my favorite referrals and let my partner Nathan tell you about how physical therapy can impact several of these areas we've talked about and more.
Hi, my name is Nathan, a first-year physical therapy student here at the U. My role on this interprofessional team is to spearhead the physical rehab for Catherine. Developing a plan of care centered around a thorough musculoskeletal and neurologic evaluation, in addition to providing education for both Catherine and her family, is crucial for improving her quality of life. Working in tandem with the occupational therapy, dietetics, and nursing teams, we aim to provide a well-rounded and holistic approach to her physical well-being. When it comes to specifics of Catherine's plan of care, I have primary findings on the left, and I have 4 key points that I have to address them on the right. First is patient education. Education is key for adherence to any plan of care. Making sure that Catherine and her family are kept in the loop ensures that everybody knows what we're doing and why we're doing it. In doing so, helps instill trust between us as clinicians and Catherine and her family. Next, pain management plays hand in hand with patient education, as helping her learn more about pain allows her to understand how and why she's feeling it. Pain is multifactorial and could very well be musculoskeletal in nature, but with the large amount of stresses that she's facing, this could be adding to her pain as well. Moving on to Catherine's safety, seeing that she's unfortunately had 3 falls in the past year, I would love to see her using an assisted device. Equipping Catherine with an assisted device allows her to traverse her environment with more efficiency and with more stability. It would improve her safety and help reduce the risk of falling again. In regards to her diabetic neuropathy, I want to teach her and her husband about the loss of sensation and how to conduct thorough integumentary checks. The last point is exercise prescription. The mobility test results that were provided within the case give me an excellent indication as to where she's at physically. I plan to use these results as a way to quantify her progress in addition to other means, such as monitoring her muscular atrophy levels through circumferential measurements as treatment progresses. Also, incorporating relatable exercises in a way that's engaging to her and involves her family. For instance, an exercise that involves using gardening tools or gardening motions add value to the plan of care and increases adherence for the family. Now, occupational therapy comes into play with her ability to use her hands, which directly impacts Catherine's ADLs. Addressing the edema and facilitating some more range of motion within her hands allows her to manipulate objects such as pill bottles that have been giving her a hard time as of late.
Hello everyone, I am Tara. I am here to discuss the dietitian role within Ms. Johnson's care team. My primary objectives are to manage her recent weight loss, address potential malnutrition, and stabilize her blood glucose levels. Given her age and health challenges, her diet must align with her SMART goals, support her medication regimen, and adapt to her specific needs. For Ms. Johnson, the focus is on weight gain, improving her oral intake, and ensuring stable blood glucose. I'll be collaborating with other team members such as physicians and nurses to keep her diet and medication in sync, and ensuring home care providers are aware of her dietary needs to support her adherence at home. So Ms. Johnson has lost over 7 pounds in the last 6 months, putting her at a heightened risk for malnutrition. This assessment highlighted that her albumin levels are in the low to normal range, which indicate potential deficiencies. Her oral intake is limited due to oral sensitivity, which impacts her calorie and nutrient intake. One thing I'll have Ms. Johnson do is collaborate with a speech pathologist who will evaluate her swallowing function and recommend strategies to reduce the risk of aspiration. After collaborating with the speech pathologist, our plan includes incorporating high-calorie, nutrient-rich foods that are soft and easy to chew. This approach increases her caloric intake without requiring too much physical effort, allowing her to meet her nutritional needs more comfortably. To support Ms. Johnson's nutritional needs, we will include high-calorie supplements like Insure or Glucerna. This will provide necessary energy and protein in a small volume that won't overwhelm her appetite. Additionally, we'll be implementing a small, frequent meal schedule of 5 to 6 meals per day. This will prevent her from feeling overly full while encouraging her to take in more calories throughout the day. One crucial factor here is carbohydrate consistency to stabilize her blood glucose, especially given her diabetes. By balancing carbs at each meal, we can help manage her blood sugar levels effectively. Family support is a key part of our plan. Ms. Johnson's daughter will be actively involved in meal planning and preparation to ensure that the dietary recommendations are consistently being applied. This will provide Ms. Johnson with both physical and emotional support, helping her feel more comfortable and connected to her care plan. Additionally, having her daughter involved will make it easier to monitor any changes in her intake and adjust her diet as needed. In summary, the dietitian's role in Ms. Johnson's care plan focuses on creating a nutritional plan that is both safe and effective. By working closely with other team members and involving her family in setting SMART goals, we aim to help Ms. Johnson improve her quality of life, stabilize her blood glucose, and improve her nutritional status. With oral health also being a critical factor in her overall wellness, I am now going to pass it over to Bradyn, who is our dental student, and he will discuss his approach to managing Ms. Johnson's oral and health needs and how it fits into her broader care plan. Thank you.
Hello everyone, my name's Bradyn and I'm here to discuss the dentist's role in Catherine's care. As her dentist, I must assess Catherine's oral health needs, promptly addressing any issues and identifying any risks of dental diseases. I will create a personalized care plan that considers Catherine's entire medical history. It's crucial to address systemic diseases like diabetes and heart disease, as they can affect oral health. This calls for integrating care across disciplines for the best outcome. It's also important to implement preventative strategies to maintain oral health. Education is key, and empowering Catherine with effective self-care knowledge and techniques is critical in maintaining good oral health. Finally, collaboration with other healthcare professionals and Catherine's family members ensures patient-centered care. Now we will look at some medical concerns for Catherine's dental care. So first, patients like Catherine with type 2 diabetes can face challenges like increased risk of infection and delayed wound healing, which can complicate dental procedures. She is also more prone to periodontal disease, creating a need for careful monitoring and tailored treatment. Next, Catherine is on warfarin, and she will experience decreased clotting and prolonged bleeding, making it crucial for me to manage these risks during any dental work. Catherine also has a prosthetic mitral valve. Because of this, antibiotic prophylaxis is essential to prevent infective endocarditis during dental procedures, so before every dental visit, I will want to confirm with Catherine that she has taken her antibiotics. Lastly, grip strength and dexterity issues can hinder proper oral hygiene. A custom toothbrush developed with an occupational therapist would be a great option to address this issue for Catherine. Understanding these medical concerns ensures that we provide safe and effective dental care. Now let's look at the specific oral health goals we set for Catherine. First, our goal is to manage her sensitivity. I'll identify the sources causing her discomfort and remove them to alleviate her pain, ensuring that she is more comfortable during her daily life. This step is crucial as tooth pain could be a factor in her weight loss. Next, we need to address any fractured teeth and areas of decay. This includes restoring fractured teeth with composite buildups or crowns, assessing the dark spots near her gum line, and removing any decay and replacing them with fillings to preserve her dental health. Improving her gum health is another critical goal. We'll focus on reducing inflammation and bleeding by teaching her proper brushing and flossing techniques to help her remove harmful bacteria in her mouth and establish a quality oral hygiene routine. Additionally, it's important to schedule Catherine for routine dental cleanings every 6 months. We'll also educate her on effective oral hygiene practices to help prevent plaque and calculus buildup. Finally, we'll help Catherine understand the importance of maintaining her oral health. Together, we'll create an oral hygiene routine that is tailored specifically to her needs. As we support Catherine in her oral health journey, it's important to recognize the connection between oral health and mental well-being. This brings us to our next focus, where we'll explore how cognition and mental health play significant roles in Catherine's health.
Hello everyone, my name is Ariella and I'm going to be discussing the role of the psychologist in Catherine's care. As a psychologist, I will be conducting cognitive and mood assessments regularly. I will be implementing cognitive behavioral therapy for both Catherine and her family members to help manage stress, depression, and anxiety. I will also be offering family counseling to help strengthen bonds and reduce stress. I will help in identifying safety risks and crisis situations and make sure to ensure timely interventions and regular reassessments of her cognitive state. Now, I would like to briefly go over the mental health goals for Catherine and her family. First, we would like to reintroduce social connection, manage her mild depression, mitigate emotional impact of her chronic illnesses, and discuss her family support. First, I would like to address Catherine's cognition, depression, and frailty. Catherine has recently lost weight, is walking more slowly, and has a lack of energy, and also has a history of falls. This could be an early signal of cognitive changes and frailty. I believe that regular cognitive assessments, such as the mini mental state examination or the Montreal Cognitive Assessment, could help monitor her cognitive status. Catherine also scored a 6 on the geriatric depression scale, which is an indicator of mild depression. Depression can negatively affect cognition, so managing her mental health is crucial. I believe that some cognitive behavioral therapy sessions would be helpful for her, as well as some social support from her family. This will all be put in place after consultation with her healthcare provider. Catherine also has a complex medication regimen. Her cognitive challenges could impact her ability to manage this independently. So I believe that medication management services or reminders such as pill organizers or maybe telehealth monitoring can help ensure she's not overwhelmed by her medications and that she's taking them adequately. Catherine also has chronic illnesses such as hypertension and diabetes, which can lead to stress, anxiety, and feelings of helplessness. I believe that CBT would also be helpful for her and help her feel in control of her health by setting achievable goals that she can reach. So, CBT will also help manage this. Next, we will be discussing incorporating family in the care. Catherine's daughter is starting to show signs of caregiver burnout, such as neglecting her own health to care for her mother. I believe that referring her daughter to a caregiver support group or counseling can help her manage her own mental health, which in turn can improve the overall family dynamic and reduce the stress for Catherine. I also believe that caregiver training is important, and transferring transportation responsibilities from Catherine's daughter be would also reduce caregiver burden, as well as that ongoing reassessment of impact and burden is also important for care. Catherine's husband has depression. He makes comments about life not being worth living. Along with that, there is a firearm in the home which raises safety concerns. I believe that psychological support for both Ms. Johnson and her husband, including counseling for her husband's depression, and a conversation about safely removing or locking away firearms should be a part of the care plan. Catherine is socially isolated. She misses her church and social interactions. I believe that community programs like online churches, online church virtual social groups, telehealth counseling can be introduced to reduce isolation and offer mental stimulation. Along with that, things like adult daycare would also help and home health services. Lastly, I believe that family being involved in every part of the care plan will help Catherine overall care. I believe that her family members should be there for each encounter, of course with the patient's permission, to help and make sure that she's following her care plan. This will show her that she has her family by her side and improve her care overall. Lastly, I believe teaching her coping strategies to handle stress and maintain a positive outlook could be helpful. Things like relaxation techniques, mindfulness exercises, picking up a hobby like painting or knitting, or even meditation could improve her emotional regulation and her overall well being.
Hello, my name is Harsheen, and I will be addressing the healthcare administrator's role in the interprofessional team for Mrs. Johnson's care. This will include financial oversight of insurance plan qualification and the benefits of these plans that adhere to Mrs. Johnson's healthcare needs. I'll be talking about resource management, which includes accessibility to necessary specialists, medications, and healthcare sites at a reduced or free of cost. Lastly, I'll be talking about coordination of care between providers, health systems, family, and patient. I'll be working closely in collaboration with social work. However, I will be addressing all the healthcare plans created by the interprofessional team for Mrs. Johnson's care. Currently, Mrs. Johnson is enrolled in Medicare. However, according to her patient profile summary, she is eligible for other plans. Currently managing multiple chronic diseases, living off of Social Security pension, reverse mortgage, and $5,000 in savings. Her primary concerns include faraway locations to clinic, cardiologist, groceries, and shopping. She has expensive medication. She has the inability to do household chores. There's no Wi-Fi or cellular devices. She's received a 4 out of 8 on the Lawton Eye ADL scale. She wants to stay at home throughout her care. There's a lack of social community, and there's caregiver exhaustion. According to the state that Mrs. Johnson currently resides in, she will qualify for Medicaid plans differently. On a federal level, she just needs to have under $3,000 in assets, have an income of 100 to 138% under the federal poverty level, and have nursing home level care necessary. In the difference between an expansion and non-expansion state for ACA, there will be no asset limitations, or there will be higher asset limitations and different income level requirements. Depending on that, she will qualify for ABD Medicaid, Aged Blind Disabled Medicaid, Long-Term Care Medicaid, and if her assets, for example at $5,000, are too high to qualify, she can enroll in spend-down programs where she'll be enrolled with a Medicaid agent who will help reassess her assets and therefore help her qualify for these plans. Furthermore, I believe the PACE program is actually perfect for Mrs. Johnson's needs, which stands for Program of All-Inclusive Care for the Elderly. It provides a comprehensive medical and social services plan for seniors, available for people over 55 and eligible for Medicare, Medicaid, or both. The goal is for seniors to stay independent and avoid moving into a nursing home, exactly what Mrs. Johnson wants. This is what PACE offers as services. This includes caregiver training and support groups for the daughter who is experiencing burnout. There's also home health care and homemaker services that help Mrs. Johnson live at home and complete day-to-day chores like meals and bathing, as well as being able to stay home. There's also social work counseling for her husband's depression. There's availability to prescription medications that she may not have been able to afford before, and many more. If Mrs. Johnson qualifies for Medicaid and she is in Medicare, she will be exempt from the premium payment and pay $0. If she stays only enrolled in Medicare, she will be paying for the long-term care premium plus Part B premium plus Part D premium, which comes to approximately $4,000 to $5,000. Therefore, I would like to qualify her for Medicaid. Through these qualifications, she will also have access to telehealth capabilities, as well as installation of Wi-Fi and cellular devices.
Thank you, everyone. We really believe that Catherine will benefit from the continuity of care and the diverse skills that each specialist can offer her. We'll use innovative resources like the PACE program and the Lifeline program to help her stay at home as long as possible. Some risks of this include the potential for an overwhelming amount of medical appointments, as well as the ongoing safety risks while we implement our plan. We would recommend setting up a medical alert service to help respond to these instances. Our goals focus initially on establishing care with each individual, implementing safety measures, minimizing harmful treatments, and establishing those goals of care. Long term, we hope for increased functional ability, optimal medical management, and improved well-being for the whole family. Frequent but coordinated check-ins are paramount here. A shared calendar and personalized reminders would be recommended. We will hold each other accountable for following up on referrals and communicating progress across the team and to Catherine and her family. Each team member should also provide appropriate educational materials that fit the individual needs of each family member, and this may include using multiple different types of tools from demonstrations to handouts. We want to remind them that they are not alone, and we will be here for them every step of the way moving forward. Lastly, I want to discuss our experience working as a team together. Our process included the use of several multimedia tools. We started with a thorough introduction of our skills and backgrounds before establishing leadership, thank you Nathan, and diving into the case. We took responsibility for different sections and presented our findings and progress to each other. That was before we actually started building the presentation. We were communicating almost daily and also holding 1 to 2 hour long video meetings each week. We were quick to adapt to peer feedback, coach suggestions, and advice we sought from outside professionals. We acknowledged that we could have improved in our time management and done a better job at assessing strengths and weaknesses particular to working on a presentation. We maintained a high level of mutual respect that grew throughout the process, and we each demonstrated responsibility and accountability despite pressure to compromise our standards due to a strict deadline. Overall, we felt as though we were a high-performing team and that it would be a pleasure to collaborate again. Thank you so much for tuning in, and please feel invited to reach out to any member of our group with questions or feedback.